Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to this segment of Healthcare Consumerism Radio. We're very pleased to have an upcoming speaker at Forum West to be joining us today to talk about his subject, and it's Ross Miller, MD and medical executive with Cerner Corporation. Ross, good morning.
Good morning or good afternoon, depending on what time zone you're in. Glad to be here. There
you go. Hey, first of all, look forward to seeing you soon. Look forward to seeing you next week at IHC Forum West in Las Vegas.
I will be there. Yeah. I'll be presenting in the afternoon on Monday.
Yeah. Give us a little background on Cerner, and let's talk about the chiropractic piece, which I think is very interesting, what you're doing there and what you see there.
Sure. I think, in general, most people may know Cerner as sort of a big electronic medical record company, having been in business for 35 years and having about a third of all the hospitals and health systems in the United States using the electronic health record. But what most people do not know about Cerner is the fact that for the last 10 years or so, we've had a very strong health benefit and health and wellness journey that we've taken actually with our own associates as Cerner employees over that time as well, and that we have a very strong presence now in the wellness space, in the on-site health center space, as well as benefit administration work with self-insured employers that have taken the living lab, as we call it, at Cerner, as a self-insured employer ourselves, and then been able to spread it into their own organizations on a national level. My particular role with Cerner, I'm the National Medical Director, working with our Population Health Services division, and I'm responsible for the oversight of our on-site health centers. We have about 40 of them in 20 states for 30 different employers around the country.
So I think we all see the parallel that on-site health centers and even near-site health centers are really exploding and growing because they do offer, not only cost benefits to that employer, but, real benefits to helping that employee and their families better manage their health and health care. But you're doing some unique things with the inclusion of chiropractic. Talk a little bit about that.
Sure. Well, as you stated, that the on-site health centers, predominant focus is really providing kind of holistic care that is evidence-based. It is a managed type of care compared to the care that may be received into the community, and there's a strong focus within Cerner, especially as part of our quality management program, for focusing on outcomes and then taking our data from the experience within the on-site health centers and presenting and or peer-reviewed publishing some of those results. So the fact that musculoskeletal is, when you kind of look at the big national data on cost drivers for self-insured employers, whether it's blue-collar or white-collar, the musculoskeletal area, along with other things like diabetes and obesity, seem to be a large driver with considerable economic and clinical burden for the employees and the employers. And so with that in mind, the idea of having on-site chiropractic care came to us to say this would be a way for us to not only manage the appropriateness of the care from a chiropractic basis compared to potentially how that care is given by community-based chiropractors, but also be able to knowing that some folks kind of believe in physical therapy, other folks believe in chiro, consider it to be a complementary rather than an alternative as part of the holistic care that is provided in a medical home and in a primary care setting. So that's kind of where our initial thoughts for having chiropractic care on site at our wellness and health centers for the Cerner associates kind of came to fruition.
Ross, Ron Bachman here. The inclusion of chiropractic care is interesting to me because I believe employees ought to have choices and there'll be different options, and we're certainly seeing different allied professionals being offered up as well as chiropractic care. We're here in Georgia in a more rural area where in many of the rural markets, the chiropractor is the leading and maybe the only medical provider in the community, usually leading citizens, and so there's not as much hesitation about using chiropractors. But tell us how the transition has occurred, because we're seeing it more and more across the country. I think the general population is more frequenting chiropractors. What's changed over the years between, because you're an MD, what's changed over the years? Because the medical profession for many years was very resistant to chiropractors. And so for those in our audience who may still be in that kind of in-between, not quite understanding the chiropractic services versus the traditional medical doctor, can you help them understand what's been happening with those relationships and the services provided?
Sure. So it's a great question, and I think what was going on originally, or at least initially, chiropractors were essentially treating the entire spectrum of healthcare diseases. Having actually been a previous speaker in a chiropractic college on faculty, and focusing on sort of helping to decide what are the appropriate areas that are within the scope of service from both a training perspective, an educational perspective, and sometimes even from a licensure and regulatory compliance perspective at a state level of what is within the scope. And in rural areas where the chiropractor may be the only clinician, that scope of service may potentially expand a bit. But I think the hesitation on the MD and the physician community side of things was when chiropractors were doing, let's say, spinal adjustments to treat type 1 diabetes in a school-aged child, which, didn't have, at least from the scientific rigor and evidence-based background, very much support. However, I think the short answer to your question is that musculoskeletal was never an area of concern. Mm-hmm. And with the fact that in today's discussion on the show and the results of our research that I'll present, it really is focused on musculoskeletal care, and I actually don't think that there's been as much hesitation on the sort of MD side of the house, as long as the scope of service and the disease states for which the chiropractic community is adding additional clinical value remain somewhat more limited than maybe in past decades.
On the musculoskeletal, it is a very, high cost many times and high frequency medical condition that people have to deal with. There's also a number of studies out there that would indicate a lot of the musculoskeletal problems come from stress. That it manifests itself with musculoskeletal issues. How do you factor into psychology, or do you, into your treatments as well?
Well, it's only the idea that the Onsite Health Center, as I mentioned earlier, really is holistic, and it really looks at the total person and integrates behavioral and psychological with traditional medical-related health. And so I don't think there's any disagreement, but with the idea of not only looking at the patient as a musculoskeletal patient, but looking at the patient in that more broad general approach that goes through their other comorbidities, that goes through their other life stresses, that goes through everything from their ergonomics in the workplace to the kinds of physical labor that they may do in a blue-collar manufacturing type of plant, to their posture, to other types of attributing factors that would include the behavior and stress as well. And because all of the on-site chiropractic care that we have in our health centers is integrated with a primary care provider, and there is a shared electronic medical record as well between the two, it helps with that ability to not have the chiropractor practice in isolation.
Ross, we've got about a couple minutes to go. I want to give you a chance to kind of wrap this and leave our audience with some takeaways, plus how they can find more information. I just wanted
to kind of share the results. We've done a couple of peer-reviewed publications already, and what we did is we did an analysis kind of comparing folks that used an on-site health center for chiropractic care versus those that didn't. And we studied almost 16,000 associates, and we actually looked at several different outcomes. So one is that folks that used on-site chiropractic care were significantly more likely to receive less radiology services than those that went into the community. A lot of the response that we heard was, well, I went to my chiropractor in the community. They initially gave me 2 or 3 medications for pain. They initially ordered several radiological studies, and they scheduled all 16 of my visits when I first walked in the door. And if you have a more managed, on-site controlled perspective for use of chiropractor in a more evidence-based fashion, that was helpful to be able to see from a cost perspective for the employer a lowering of radiological procedures. The other things were just the number of visits, the number of repeated visits, the number of emergency department visits, and even just any type of outpatient medical visits were all higher in the community-based chiro versus those that were on-site. The final point, which is important, is the kind of question back to us, which is, well, if you limit the number of visits or you're more restrictive in the management, do people actually still get better? And we actually did a analysis to make sure, using 3 different standardized validated instruments for improving neck pain, migraine, or low back pain, which were the 3 main diagnoses we studied, and actually found clinically and statistically significant improvement in their scale, in these validated scales for the patients enrolled in the study that used the on-site, despite the fact that they used less drugs, had less x-rays, had less visits, and less referrals.
Well, Russ,
kind of a high-level summary.
No, that's very good, Russ, and we really appreciate you joining us today. And, for those of you attending IHC Forum West, Russ will be conducting a workshop on November 11th at 2:30. For those not, you'll be able to access his presentations after the event on our website. Russ, have a great weekend. We look forward to seeing you out in Las Vegas. To the rest of our audience, we'll see you next week on Healthcare Consumerism Radio.